You know, in your 50s, you're probably thinking about maybe ahead to retirement, worrying about how you'll pay for your child's college, maybe even thinking about a child's wedding.
But one low-country couple is changing diapers instead. After having a baby in their 50s, they opened up to Aisha Tyler about their journey to have a baby after 50.
When they see us with the child, you know, first thing is that your grandchild? It's like, no.
Pastor Daniel Russell Jr. and Judith Russell get that question a lot. Their son was born a little over a year ago after years and years of trying.
I always wanted a baby.
We started when we were in our 20s.
And again in their 30s.
Getting discouraged, getting disgusted, getting frustrated.
And again
in our 40s, where you know, it's taboo now even to think about a child.
We did almost everything naturally that we could have done. So in starting taking different avenues.
But the Russells say those didn't work either.
There are times where we cried. There are times where we laughed. There were times where we even questioned God.
The Russells started considering adoption.
By the time I looked at the paperwork and saw how thick it was, I put it back with DSS. I put it back, put it down.
Then Judith's doctor recommended seeing reproductive endocrinologist Dr. John Schnorr. At the time, Judith was in her late 40s.
They had infertility from a decreased number and a decreased quality of eggs within the ovaries.
Dr. Schnorr recommended egg adoption or egg donation, where an egg donated by a healthy woman would be fertilized with Daniel's sperm and placed back in Judith's uterus. Daniel says there was never any concern that the egg wasn't theirs.
When you go to the store and you buy the egg from the chicken hatch, and once you purchase that and take that home, that's your egg. So that was my philosophy.
Dr. Schnorr says a woman's uterus can be healthy well into her 40s and 50s, as long as there are no underlying health problems. That follows national guidelines which state egg donation can be done on healthy women age 55 or younger. Dr. Schnorr also says there are no apparent risks with carrying a baby and giving birth in middle age.
I want to have my own child. I wanted to carry my own child. I wanted my husband to see me pregnant. I wanted to feel all of that.
After choosing a donor and having the procedure done, the Russells finally got the news they had prayed so long for. Judith was pregnant at 51.
I just bust out in tears and I just started crying.
Judy carried that baby like a young person.
During Judith's 8th month of pregnancy, her husband surprised her with a ceremony to renew their vows.
In November, what a double blessing is that my wife was able to walk down the aisle pregnant and her dad on her arm in front of about 250 people. We had a wedding, renewal, and a baby shower all in one.
Fast forward 14 months and the Russells are now learning the ropes as new parents with Daniel Russell III, also known as 3D.
It was good to experience that because we thought that at our age we would never experience that.
The Russells say their prayers were answered because of their strong faith.
There is hope and it can happen. Don't give up. It can happen. I cannot imagine my life without him.
Dr. Schnorr says egg donor treatments can cost anywhere between $15,000 to $25,000, but financing is available and some insurance companies cover egg donor treatments. A wonderful couple.
Oh.
The baby is adorable. 3D.
3D is what they call it.
Nickname.
Story.
Older parents can be greater parents.
Yes,
can be
they can.
terrific because they're more mature and they really appreciate the babies.
Exactly. Yes.
You know all too
I
well,
know
right?
Yeah,
all
you
about that.
would know that.
I
Yes,
know
How about
that
number
firsthand.
7, Bill?
No, that's all right.
All right.
I've
Lucky
had
number 7.
Thanks, Aisha.
Oh, thank you.
I've had